Welcome to the course on global environmental change and non-communicable diseases. Today's session is the very first introductory session on the course, and we'll be talking about environmental change and planetary health. So it's an introductory session that will last for about an hour, and I hope you find it helpful. So I'm Kristine Belesova, Senior Lecturer in Global Population Health at Imperial College London, working together with Chris Millett and others on the NIHR Centre in Global Health Research on non-communicable diseases and environmental change. And yeah, let's make a start. So just to give you a bit of an overview about this course, we will have 5 modules on the course. So today's introductory session is part of the first module. Lasts 60 minutes. The second module will be structured differently from today. We will have 4 recordings of about half an hour, 20 minutes each. The first recording will look at air pollution and non-communicable diseases, the second at water salinity and non-communicable diseases, then dietary diversity, non-communicable diseases, and heat stress, non-communicable diseases. These recordings are delivered by the center's leads in different countries, representing the different themes that the center is working on. And these are there for you to have a sort of more detailed insight into each one of these areas and understand how such an environmental change as air pollution, water salinity, dietary diversity, well, dietary diversity isn't really an environmental change, but it's a food system. It's slightly different. And heat stress, how do they link with non-communicable diseases? What are the pathways of impact? What's the scale of impact globally? And what do we need to understand about them? So you will be given about a couple of weeks to watch the recordings. We'll be releasing them gradually. And after you finish the recordings, you will have an interactive group exercise where you'll be split into groups, and we'll ask you to prepare your own presentations of 10 minutes to talk about environmental risk factors. And we'll come to the details of the presentations at the end of the session. So this is just to flag it up. Then the third module will be a little bit more similar to today's session. We'll have a longer session, however, we'll have 120 minutes, where we will come back to the key concepts that we discussed today. We will go through your presentations, so that's the time when you'll be given the chance to present as a group, and we'll give each other feedback, discuss what are some of the difficulties in applying concepts from this session to your own work that you'll be presenting, and other questions. Then the 4th module will be happening on the 11th of April, and we'll have a live webinar just as we have today in a similar format of about 60 minutes. And we'll be then looking at the principles of what do we actually do about the environmental changes and non-communicable diseases. So we'll be talking about mitigation and adaptation and how they go together, and what are some of the essential topics for designing solutions to environmental change and non-communicable diseases. And in the last module, we'll be talking about approaches that are required for planetary health research. So we'll be talking about things like systems thinking, transdisciplinary collaboration, innovation, and transformative change. These are quite big buzzwords in our area of research, and we'll look at them in more detail. And you will also have an opportunity to think about how some of these approaches can be applied to your work, and how your work leads to solutions that can be implemented and bring benefit to local communities on the ground. So overall, here you can see the intended learning outcomes of the whole course, so of the whole 5 modules, and you also have these in your module handouts, course handouts. So the first outcome is to understand the concept of environmental risk transition and what does it mean for non-communicable diseases. And then we'll be talking at what are the different public health paradigms, how they have changed through history, from the biomedical perspective all the way to planetary health perspective. Then we'll be looking at the different mechanisms by which environmental changes are affecting non-communicable diseases, And we'll also acknowledge the importance of the interactions, because there are many interactions there. We will then have the opportunity to apply a planetary health perspective to your own work and research, which will be mainly done through the presentations, and we'll also be considering how to incorporate environmental risk factors in non-communicable disease risk assessments and management throughout life course. Then we will practice identifying and assessing different mitigation and adaptation strategies towards the end of the course, and we'll also recognize the importance of these new or novel approaches like systems thinking, transdisciplinary collaboration, transformative change, and others, and we'll think about how to apply those to your own research. But specifically today, we will focus on the following 4 learning outcomes. So the first is to distinguish public health paradigms ranging from biomedical perspective to planetary health. Second, understand the concept of environmental risk transition and what does it mean for non-communicable diseases. Understand how global environmental changes and what are the global environmental changes that our civilization is now facing, and we'll also practice describing the relationship between environmental change and health. And that's just a reminder that other 2 learning outcomes that you can see at the bottom of the slide is something that we'll talk about in terms of what you will need to do for your group work. That will come at the end of the session. And just to start with the concept of health and public health, I'd like to ask you to look at these 4 images and think, how can you tell whether the people in these images are healthy or they're not healthy? And what is the role of public health in each one of these images? So I'll give you 1 minute or maybe 30 seconds to think about, formulate some ideas, and type your responses in the chat, or if you wish, you can also raise your hand and talk. We're just 11 people, so I'm sure we can just talk to each other to make it more interactive. So have a little bit of a think and raise your hand and share your thoughts. So the question again is, what are the different, so do you think these people are healthy or no? And what is the role of public health in each one of these images? Right, who'd like to respond? There's no right or wrong answer here. It's just really reflections and ideas. Anything you'd like to share? If you have any problems with speaking, you can type your response in the chat box and we'll read it out for you. Someone has to start. Who will be the brave person starting? So did everyone understood the question? We're talking about what are the health aspects in the images and what's the role of public health in these images. So we can see a healthcare setting with an elderly lady being taken care of. We can see a child being vaccinated. We can see some construction workers outside performing their duties. And we can see a lady running in a natural environment in a park, presumably. Thank you, David. So you think all pictures show healthy people because they seem to be able to work and to perform other activities and be productive. Yeah, the pictures on the left. Okay, yeah, the pictures on the left are showing active people. That's right. And what does it tell us about public health? Would public health be advocating for them to be active in certain ways, to take any precautions? So perhaps the outdoor workers would need to take certain precautions to make sure they're safe and healthy in their workspace. How about the lady at the top? She's running, there's sun rising. We don't really know about the outdoor temperatures at that time or the level of air pollution. It looks like a beautiful green environment, which probably will be very stimulating for her, in terms of her mental health and well-being. And of course, she's performing active exercises, which is good for health. So she's sort of promoting her own health. Then on the right, we see slightly different images. The vaccine, which is a prevention measure to prevent diseases, and an elderly lady in a healthcare setting. So, to come back to the point about these images, they show very different aspects of what health is, what public health is, and how do we take care of health, starting from cure to prevention to promotion to health and safety measures. And historically, we have been thinking about public health in fairly different ways. So starting from antiquity to 1930s, we were mainly seeing public health as a means of health protection. Public health wasn't really a term then. It was essentially about protecting our own health to the extent that we understood at that time. Then from 1980s to 1940s to 70s, that's the time when actually the discipline of public health started taking shape, and it was mainly taking shape in terms of the sanitary movement. So we were trying to control any kind of pathogens or any reasons that may lead to poor health. And then in the 80s to 1930s, public health became more in as a discipline of contagion control. So we're again trying to control any harms or pathogens in our environment. In the 40s to 60s, it transformed more into a preventative medicine. In 70s to 80s, it became more focused on primary healthcare provision. And 90s to present, it has much more emphasis on health promotion. So healthy behaviors, physical activity, healthy diets, and other aspects like that. And more recently, we've come to realize that also our environment hugely matters for our health. So concepts like ecological public health started emerging. So public health approach that integrates social and environmental determinants of health, and the concept of planetary health, which we'll be talking about later in a lot more detail, also started emerging. So that's how the thinking about public health has emerged. And of course, some disciplines would still adopt more biomedical perspective, for example, medical doctors, but other disciplines would be talking about public health in more holistic and broader terms and thinking about environmental determinants and environmental changes and their impact on health. So here's another image that I would like you to think about. It is a graph taken from a paper by Corbett and others, published in 2018, and it shows the differences in the life expectancy at birth and the total fertility rate across different countries in sort of earlier years in the 18th to 19th century, and it shows the same measures in kind of modern days around 2015. And you can see that there's quite a bit of a difference, that total fertility rate used to be much higher, life expectancy at birth was much lower, but now we've come to having much higher life expectancy at birth and lower fertility rate. So what do you think may have actually contributed to these changes? There are many different factors. So what do you think some of those factors could have been? Could you either respond in chat or just raise your hand and talk? Any ideas? Yeah, I can see better health services. Absolutely, that's right. Any other ideas? Improved healthcare. Thank you. Anything else beyond the health sector? The rule in the country. So you mean governance? Yeah, absolutely. Governance can be very important in terms of the regulation and the standards and the environment that we live in, etc. Anything else? Better prevention measures and new health technologies, absolutely. That's a crucial one. So vaccine development and sort of the 18th century has certainly contributed to these changes hugely. Also, not just health technologies, but improvements in agriculture, improvements in transport and food distribution also had huge impact on lowering our mortality rates and improving health. Also improvements in education, in health promotion, sort of public health, environmental regulation, and other policies have been quite important. Urbanization has been another process. So as we've moved from more agrarian modes of living into urban environments, our mortality also started to decrease. It also helped to improve the hygiene, create public health infrastructure and other public infrastructure, provision of safe milk, clean water supplies, sewage. So a lot of these changes in the society have been very important. So all of your answers are absolutely correct. So that kind of leads us onto the concept. So how have health hazards actually changed over time? And we tend to think about the traditional hazards that were predominant in the old world or are still sometimes predominant in developing countries now or in rural areas. And the traditional hazards have been mainly infectious agents, inadequate housing, shelter, poor quality drinking water and sanitation, and various hazards like childbirth. And now we have the emergence of the modern hazards, which are increasingly emerging in the urban areas and industrialized areas, and also have been more predominant lately rather than in the history. So that includes tobacco smoking, transport hazards, pollution from industry, overuse or misuse of chemicals, poor diets, climate change, other environmental changes. And the shift in the hazards has been occurring because of the demographic transition, but also it kind of brings along with it epidemiological transition. So we see that there are changes in the way how in the fertility rates, in the mortality rates, in the age distribution in the population. So the populations are now aging, but also the epidemiological profile is changing, and we'll talk about that in a minute. And so with the health hazard transition, there's also another type of transition we're talking about. We're talking about specifically environmental risk transition. And in this graph, you can see that the risks related to sanitation have been, for example, decreasing, and environmental changes have been on the rise, but there are also various environmental risks, such as ambient air pollution, that sort of is more in the middle. So if you think about the x-axis as the scale from poverty to kind of wealth, then global environmental changes such as carbon emissions have been increasing with increasing wealth. Sanitation risks are decreasing with increasing wealth, but then air pollution and various other pollution forms are actually kind of peaking in the middle and decreasing as we get wealthier, but also decreasing as we get poorer, because there's less production happening in the poorer areas, and less production is happening in, or polluting production is happening in the very wealthy settlements. So these are kind of the three different patterns of environmental risks. And overall, the burdens have been very much shifting from local to global, from immediate risks to delayed risks. So we actually see that a lot of the risks that we're experiencing in terms of our health are occurring way longer after we've been exposed to the risks. So we might be exposed to air pollution in childhood and developing various cognitive problems later in life. Or we might be exposed to poor diets as we are growing up, particularly children up to the age of 2 years. If they're undernourished in that period, then they are more likely to experience non-communicable diseases, cardiovascular diseases, metabolic diseases in their adult years. And we're also shifting from more kind of direct health threats to the environmental support systems on which our health depends. And here you can see how does it actually look like in epidemiological terms. So from sort of 1990s to 2010, we see a decrease in communicable diseases, maternal, neonatal, and nutritional disorders, and we see a rise in non-communicable diseases globally. And at the very bottom, the injuries have kind of remained roughly stable. Maybe there's a tiny bit of an increase over time. And if we look at the pattern of non-communicable diseases by income level of countries, then you can see that non-communicable diseases since the start of this millennia have been quite consistent and consistently high in high-income countries. They have been increasing in the upper middle countries. Even steeper increase we see in lower middle income countries and much steeper increase in low income countries. So it's definitely an issue in all groups of income. And the world average is, of course, an increase in non-communicable diseases. So in historical terms, technically, our human population has never been healthier than it is now globally. So we have the best life expectancy that we've had since a long time. The poverty has been declining rapidly. Child mortality has been declining. So it all looks quite good if we look at these aggregate metrics. But then the problem comes when we look at the environmental metrics. So if we think about the carbon emissions, those have been tremendously increasing. Ocean acidification, which occurs as a result of increased carbon dioxide concentrations in the air because the ocean absorbs carbon dioxide, has also been increasing, which has many implications for the marine life systems. The energy use has been incredibly increasing. As you can see from the graph, we're also losing a lot of tropical forests, which are the lungs of our planet and are absorbing carbon dioxide. We're using a lot more water than we ever have, and there are freshwater scarcity issues in many areas. And we've also seen sort of instances where cities are running out of water. For example, Cape Town was running out of water some years ago, and drastic measures had to be put in place to manage the situation and manage water use, and almost to the point that local authorities were offered water imports from other countries. And we also see an increase in the use of various chemicals, including fertilizers and pesticides and other substances that can have implications for the quality of the environment, but also for our health. And you may have heard already about the concept of planetary boundaries. So this is a framework that was developed by Johan Rockström and his colleagues at the Stockholm Resilience Institute a number of years ago. And the planetary boundaries are 9 boundaries, which you can see here on the slide: climate change, novel entities, stratospheric ozone depletion, atmospheric aerosol loading, so that's essentially various forms of air pollution, ocean acidification, biogeochemical flows, which include phosphorus and nitrogen, so that is very much linked to the fertilizer and sort of use, freshwater use and depletion, land system change, so that's about how are we using our land cover, how is the land cover changing? We typically see an increase in the urban areas. We see that many forests get cleared for agriculture. So large transformations are happening with the land, and that has various implications on the systems related to land. Biosphere integrity is also being lost. So that's related to biodiversity loss, and you can see that they're separating it into functional diversity and genetic diversity, and both are under threat. So these boundaries are essentially showing us that once we surpass these boundaries, we are facing very large-scale irreversible changes in our environmental systems. And once these boundaries are crossed, then the very existence of our civilization becomes under question, because we can't really function without a proper climatic system. We can't really function without a proper sort of biosphere integrity or properly functioning land systems. And there are many different connections to how we as humans depend on these systems. And you can see that the diagram is color-coded. So the safe zone is the green zone here in the middle. Then the yellow zone represents the risk of the level of uncertainty or the risk. And the green zone is, the red zone at the edges is the high risk zone. So we really should be operating within this green zone here. And you can see when the framework was developed, we already were not within the green zone by a number of the dimensions. And if you'd like to know a little bit more about these different boundaries and the science behind them, you can have a look at a recent documentary on Netflix. So this is Johan Rockström, the person who led the development of this framework, and he's recently produced this film together with David Attenborough on breaking the boundaries. So you'll have a lot more insight there. It's about 1.5 hour movie, definitely worth watching it. So have a look. And the Planetary Boundaries Framework has been updated through time. So the first version was developed in 2009, then it was updated in 2015 and 2023. And you can see in 2009, there were 3 boundaries that were crossed. In 2023, we've already crossed 6 boundaries. So the state of our environmental systems hasn't really been improving, but in fact, it has been degrading quite significantly. A related concept to planetary boundaries is the donut framework, as we call it, donut, because it looks like a donut. It's sort of hollow in the middle. And it was developed by Kate Raworth from Oxford University, and it integrates the planetary boundaries here, sort of at the edges, which is where we should, as a civilization, contain our impact. But it also acknowledges that we have social foundations that need to be met. So our own needs for water, energy, food, health, education, so that we can be well and healthy. And really, the operating space here from this perspective is that we need to be somewhere within this donut area, the green area, which doesn't put too much pressure on the environmental systems, but also doesn't put too much pressure on the human systems, and maintains this delicate balance around the donut. So thinking about the planetary boundaries, how do you think the planetary boundaries and the environmental changes that they represent, how are they linked to human health? Can you think of any examples? Again, could you either raise your hand and speak, or just type your response in the chat? Any ideas would be great. If it's easier, I'll put the picture of the planetary boundaries framework again so you can have them in front of you. So how do you think climate change is affecting human health? How do you think biodiversity loss is affecting human health? How do you think freshwater overuse is affecting health? How stratospheric ozone depletion is affecting health? How about land system change? Yeah, thank you, David. So you're saying biochemical use in farming could be harmful on health because of the harmful residues? Absolutely right. Um, Overuse of pesticides can be very harmful for human neurological system. So many pesticides, for example, are developed mainly to attack the nervous system of the insects. But unfortunately, they are so strong that the small residue amounts are also harmful for people. And it has been shown that sort of unsafe application of pesticides is linked to various health outcomes in the farm workers who are applying pesticides if they're exposed through skin, etc. But it also can affect local communities, um, especially children whose nervous systems are still developing and who tend to have a slightly different interaction with the environment, like toddlers, for example, crawling and touching grass more than sort of adults, for example. But so is the fertilizers. So fertilizer imbalance can also cause various environmental problems and trickle down into impact to human health. Hollow path, thank you. Increasing the number of air pollutants can be linked to various diseases. Absolutely. So air pollution is a huge killer. And as you say, it does lead to pneumonia, lung cancer, also neurological effects and many other conditions, and generally exacerbates any underlying non-communicable diseases, cardiovascular diseases. Aretha, thank you. So all systems are connected with human health, and the air pollution, food safety, atmospheric change, all of these affect human health. Yeah, they do, absolutely. Let's think about the more specific mechanisms, how these impacts are happening. Sharif, thank you for bringing up the plastic pollution. Absolutely. So when we see the planetary boundary of novel entities, plastic pollution is actually something that belongs to that boundary. So novel entities is any kind of entities. It could be endocrine disruptors or anything else that we're releasing into the environment. It could be plastic. And we don't exactly know how it is affecting human health, how it is affecting the environment. So there's a lot of uncertainty around that boundary. And the NHR Center is doing very interesting work into this question in Indonesia. So we look forward to your findings. Thank you, Haran. Changes in land use, deforestation, urban sprawl, intensive agriculture can lead to environmental degradation, loss of ecosystem services, and increased exposure to harmful substances. Absolutely, that's very true. So a lot of the deforestation, especially if it happens by burning forests, leads to air pollution that then gets transported and affects local communities. There's a fair amount of air pollution coming from that. Also, local communities are losing their natural sources of some of the foods. So foods that they could previously gather within the forests are changing, and perhaps the dietary diversity in the communities is changing as a result. Of course, urban sprawl is also leading to various health challenges, including how active we become, how much do we travel by car or by public transport. Air pollution becomes an issue, but also just the urban density, how crowded cities are is quite impactful for mental health and various cognitive abilities. Right, so excellent examples. So we found plenty of connections to human health. And in fact, there are many, many more. And if you would like to know more about the connections, you have an essential reading set for this session. In fact, you have two of them. One is a review by Howie Fromkin and Andy Haynes, which is looking at how global environmental changes are linked to non-communicable diseases. So that's a very concise and absolutely excellent synthesis of the state of evidence on the connections between non-communicable diseases and human health. So it goes from land system change to climate change, biodiversity loss, all of it is covered there. And of course, as any review, it covers what has been researched and what has been produced scientifically, but it also acknowledges what are the knowledge gaps. So please do take a look at it. And another paper is the report by the Lancet Commission on Planetary Health. So that's the Lancet Rockefeller Commission on Planetary Health. And it is a perfect introduction to what planetary health is. And it gives you a lot of background. So now coming to the concept of planetary health, there's sort of two definitions. One is about what planetary health is as a matter. So it's the health of human civilizations and the civilization and the natural systems on which we depend. So all the natural resources. So planetary health acknowledges that it's not just the human that needs to be healthy as an individual or as a population, but we also need to make sure that our natural systems are happy. And with that comes the health of the species within the natural system, of animals, plants, and the functioning of environmental systems. And we can also think of planetary health as an academic field or a research field. And here, Planetary Health Alliance defines it as a solutions-oriented transdisciplinary field and also a social movement, because we don't want to just research planetary health, we also want to act on it. And it is focusing on analyzing and addressing the impacts of humans on natural systems and subsequently on human health and all life on Earth. So planetary health is very much about acknowledging that a lot of these environmental changes that we've been talking about, that you can see in the planetary boundaries framework, are actually a result of our own human activities. So they are anthropogenically driven. So climate change is recognized to be anthropogenically driven, and so are many other of the planetary boundaries, in fact, all of them. So it's about acknowledging our own responsibility and trying to think of solutions that are benefiting and improving our environment, reducing the pressure on these planetary boundaries, but also benefiting our health in the longer term and in the shorter term. And we'll be talking about the solutions in more detail in subsequent sessions. But this is just a diagram to remind you that all planetary boundaries are linked to various health aspects, from non-communicable diseases, infections, nutrition, and mental health. And today we're more so talking about non-communicable diseases. So when we're talking about the pathways or the mechanisms, how environmental changes are linked to human health, we can categorize them into direct and indirect mechanisms. So direct mechanism could be floods, heat waves. So for example, a flood directly affects, it can kill people. There can be injuries, there can be infectious diseases transmitted. Heat waves are directly causing heat stroke and reducing our wear capacity. And so are other direct impacts. But then indirect impacts can be mediated by ecosystems and by social systems. So ecosystem mediated effects could be changes in the infectious disease vectors. Those could be changes in the ecological systems that are affecting the vector abundance, for example, and that is causing risks to human health. It could be reduced food yields. So, for example, climate change might be creating abiotic conditions for crop growth that aren't really favorable. So crop yields would be reducing. There would also be changes in the pests and all sorts of pathogens, and the crop yields would be changing, which is causing impacts on food availability and food security and eventually nutrition of populations that directly depend on crop yields. And that's particularly prominent in subsistence farming populations, but can also be impacting global food systems. So if we see shortages of food production in certain areas, it affects global food prices, and particularly low-income groups across the world would be less able to purchase certain food groups, which is also eventually having an impact on their nutrition. And then there are social systems. So sort of already when talking about the food systems, we got into the social systems because there's a market mechanism that is mediating it. So often it's really hard to actually separate where the ecosystem mediation and the social system mediation is kind of happening, because in practice they act together a lot. And other social system mediated effects could be changes to the livelihood. So for example, if food crop yields fail, farmers are suffering in terms of their income, they're less able to afford school fees, healthcare fees, etc. So the impacts can be quite complex. They can also be displaced in time, in space. So air pollution, for example, travels quite far. And if you're burning a forest in one country, actually the health of people in another country can be affected. And also they would be deferred in time. So we talked before about poor nutrition in early life and how it affects the health status later in life. So that's an example of a deferred impact in time. And what's important to understand is also that what do we actually mean by risk? And when we talk about risk from global environmental changes, this diagram is really helpful because it shows you that risk is actually a function of three things. It's a function of a hazard. So, for example, an extreme event like, I don't know, a heat wave happening, it's a function of exposure. So for people to suffer from a heat wave, they actually need to be in the location where that heat wave is occurring. They also need to be exposed to that heat wave. So if they're sitting in an air-conditioned office throughout the heat wave hours, they won't be affected. So they need to be exposed. And it's a function of vulnerability. So certain environmental exposures wouldn't be affecting people who are strong, healthy, sort of but they will be affecting people who are frail, who are elderly, either children. So we need to think about all of these three factors, and when they come together, that is really what defines risk. So just to emphasize again the difference between the two terms, hazard and risk. So hazard is essentially just a factor that may or may not adversely affect health. It's a source of danger. But risk is the probability that an event, an impact, or for example, health impact will occur. And it is a function of a hazard, exposure, and vulnerability. And when we're talking about hazards, we can also categorize hazards by route of exposure. So for example, hazards can be mediated by air, by water, land. We can also talk about hazards in terms of what is the agent that is causing hazards. So it could be particles, it could be lead, it could be electromagnetic fields or something else. We can also categorize hazards by time. So there are various, childhood environmental hazards or lifetime environmental hazards, etc., and by location. So work hazards, sort of home hazards, etc. And it's important to understand that there can be many different routes through which the same type of hazard or multiple different hazards are affecting human health. There can be multiple agents involved, multiple points in time when people are exposed to a hazard. There can also be multiple settings where they're exposed to the same hazard or different hazards. So, and all of the impacts of those hazards and the exposures are often multiplying. And sometimes they're interacting, sometimes it's nonlinear effects and quite complex. And here you can see a framework called Deep Sea Framework. Deep Sea because it's just the abbreviation of the different components of the framework. And it starts with the driving forces, pressures, states, exposures, effects, and actions. So driving forces for various environmental changes can be, for example, the need for energy for economic development. It can be our population growth, food demand, technological changes, and then there are various pressures that are resulting from these driving forces. So emissions of greenhouse gases, air pollution, overexploitation of fresh water, etc. And then there are states. So what environmental states are resulting from these anthropogenic pressures? So the state of our climate system is changing. The state of our biosphere system is changing. Our biodiversity is being lost. Oceans getting acidified, fishery decline, etc. So that's the environmental state. And then from those states, we can define specific exposures. So air pollution would be a specific exposure. Changes in temperature, rainfall, and extreme events is an exposure. Dietary changes, and so on. And then effects, so cardiovascular, mortality, undernutrition, diabetes, etc. And also the actions that we can take. And then the actions link back to all of these different levels. And we'll be talking about that in the following sessions more. But the actions can be addressing the effects. So we can be curing what has already happened to our health. We can be addressing the exposures, or we can be addressing the state of the environmental system, or we can be addressing the pressures that we're exerting on the environmental system, or we can actually be addressing all of the driving forces for the pressures. And in reality, we need action at all of these different levels. And you can see that the yellow bubble at the bottom is also vulnerability. So vulnerability is sort of modifying this link between exposure and effect normally, and it can be intrinsic or it can be acquired. So people of different age, they're intrinsically more vulnerable to some things than others. Gender can make us more vulnerable to certain things, or socioeconomic status, disability, and other factors. And in a way, our actions could also be linked to vulnerability. So for our actions, we can also modify the acquired vulnerability, perhaps not the intrinsic. And the final slide is just to emphasize that a lot of the environmental changes that we've talked about, they're hugely interacting with each other. So biodiversity loss is linked to energy provision. It's linked to urbanization, and urbanization is linked to biodiversity loss, and so on. And in fact, here you can see these kind of broad, high-level interactions. But if we think about this deep sea diagram, in fact, within every one of these boxes, there's plenty of interactions, and there are plenty of interactions across the boxes as well. And such diagram can be developed more specifically for different environmental changes. This one is kind of an overview of different environmental changes pertaining to NCDs, but it can be elaborated in a lot more detail for any specific pathway.